Let's take you to central London and the Fuller inquiry. This is an inquiry following the crimes committed by necrophiliac killer David Fuller, who abused at least 100 deceased women and girls. The inquiry is releasing its findings. Let's take a listen.
The security and dignity of the deceased is a matter of relevance to us all. Despite the lack of legal status for the deceased, we all expect our loved ones, and indeed ourselves, to be looked after with the same security and dignity after death as whilst alive. David Fuller's crimes shocked me when I first heard about them and continue to appall me as I led this inquiry's work. These crimes showed that the arrangements to protect the security and dignity of the deceased in the hospitals where Fuller worked were inadequate. In Phase 1, the inquiry considered how Fuller was able to offend undetected for so long in the mortuaries of hospitals in Tunbridge Wells. I reported our findings in November 2023. I made 17 recommendations to the Maidstone and Tunbridge Wells NHS Trust and to Kent and East Sussex County Councils. They were intended to prevent anything similar happening there again. I was also asked to review the arrangements in place to protect the security and dignity of deceased people in other hospital and non-hospital settings across the country. The Phase 2 report, which is published today, gives my assessment of the current situation. I make wide-ranging recommendations for changes that are necessary to provide the security and dignity for the deceased that we all expect. In addition to NHS hospitals across England, the inquiry reviewed arrangements in local authority mortuaries and body stores, hospices, NHS ambulance services, centres for medical education and training, independent healthcare providers, and in funeral directors. I have also reviewed the current oversight and regulation of these services. My findings and recommendations for the funeral sector were published in an interim report in October of last year. The arrangements for the care of the deceased people are both complex and interconnected. There are multiple organisations with different governance and operating models in each of the sectors that we reviewed in Phase 2. The sectors I have considered are large. Across England, there are around 4,500 funeral directors, 204 NHS trusts, 317 local authorities, over 200 hospices, and more than 14,000 residential and nursing homes. This is the first time that the security and dignity of people after death has been reviewed so comprehensively. Inadequate management, governance, and processes helped create the environment in which David Fuller was able to offend for so long. These weaknesses are not confined to Maidstone and Tunbridge Wells NHS Trust. I found examples in other hospital and non-hospital settings across the country. The security and dignity of people after death do not feature in the governance arrangements of many organisations which are caring for the deceased. I have therefore come to the conclusion that the current arrangements for the regulation and oversight of the care of people after death are partial, ineffective, and in significant areas completely absent. I have asked myself whether there could be a recurrence of the appalling crimes committed by David Fuller. I have concluded that yes, it is entirely possible that such offences could be repeated, particularly in those sectors that lack any form of statutory regulation. During the inquiry, I came across a number of recurring themes. Firstly, abuse of deceased people can be deliberate, or it can result from negligence or incompetence. Secondly, organisations and individuals tend to view any threat to deceased people as most likely to come from outside their organisation rather than internally. Thirdly, there is an over-reliance on trust and long periods of employment as a mechanism for internal governance and control. And lastly, many organisations are failing to explore systemic risks or to think the unthinkable. I urge all those involved in the care of people after death to challenge themselves on these issues, to question whether they uphold the same standards in caring for someone after death as they would if that person were alive. The deceased are as vulnerable as the living. They are worthy of the same level of protection. The harm inflicted on David Fuller's victims and the hurt and trauma experienced by their families must never be repeated. At present, I cannot give that assurance. The recommendations I am making today are designed to protect the security and dignity of people after death. Most of these recommendations are to specific sectors. Some have wider relevance and are addressed to the government and to existing regulators. They all need to be implemented to ensure that deceased people are properly protected. My overarching recommendation to the government is that there must be statutory regulation in place to protect the security and dignity of people after death, whichever setting or institution they are in. My recommendations are necessary, and as a society we owe it to everybody to ensure that they and their loved ones are cared for securely and with dignity after their death. I would like to thank everyone who has contributed to the work of this inquiry, especially the families of Fuller's victims, who bravely shared their experiences with us in Phase 1. Those experiences have continued to be a driving force behind this inquiry throughout Phase 2. It is essential that the recommendations I make today and in my interim report on the funeral sector are implemented without delay. Thank you.
Thank you, Sir Jonathan. So we'll now open up for questions. As I said, I'll ask that you state your name and the organisation that you're here on behalf of. Please keep to one question and one follow-up if necessary, just to ensure we're moving as quickly as possible. Thank you, Jason.
Jason Farrell, Sky News. You say you called for regulation in October in your interim report. Have you had any response from the government?
The government indicated that they would respond to the interim report when they responded to the Phase 2 report and recommendations, but in their response to the Phase 1 report, the government did commit themselves to ensuring that the security and dignity of the deceased were protected. So if you...
Have you seen them make moves towards doing what you're recommending?
Well, I was reassured by the response to the Phase 1 report and the commitment that the government made to ensure the dignity and security of the deceased.